Okay. So good morning, everyone. That's a hard talk to follow. I'm going to show you the example of what is not full of pictures and active learning. So I'm just going to be kind of giving you some facts about financing and treatment of substance abuse. I'm a health economist and a health services researcher. So I study the delivery of healthcare. My research is focused on delivery of mental health and substance abuse care, but also on Medicaid policy and how Medicaid policy impacts the delivery of care. So today I'm just going to talk about give you an overview of what's the substance abuse treatment services that are available in Florida, how those are financed and what we spend on those. I'm also going to go over some relevant recent health policies related to substance abuse, and then just briefly go over some issues related to things that affect the demand for substance abuse services as well as access to substance abuse services. All right, so I went to SAMHSA actually and pulled this information. So there are 793 facilities in Florida that provide substance abuse treatment. And so I'm going to be giving you some results from the National Survey of Substance Abuse Treatment Services. And there were 726 out of the 793 facilities responded to this, so it's a pretty good sample. So one thing to notice is that the majority of them are private for profit. 54%, 41% are private nonprofit, only 5% are run by government, and that includes all kinds, local, state, and federal. Although 95% of these treatment facilities have been accredited, licensed, or certified to provide some substance abuse treatment. So what are the types of substance abuse care that are available to people? So out of all of these facilities, 82% of them offer some form of outpatient treatment. So in 76% of those cases, they just offer kind of regular outpatient substance abuse treatments. 42% offer intensive treatment, and about a quarter offer day treatment or partial hospitalization, and about a quarter offer methadone and buprenorphine maintenance or naltrexone treatment. Just as an aside, so in the previously they're saying so you need to have certification to provide substance abuse treatment, but you don't need any certification to prescribe addictive drugs, which just seems a little backwards to me. All right, so back into the types of substance abuse care. So only 29% of facilities offer some kind of residential treatment. About 60% offer it for short stays, so less than 30. 71% are actually offer long-term treatment. And these are of the residential treatment facilities. Only 8% of facilities offer inpatient treatment, but among those that do offer inpatient treatment, nearly all offer a detoxification services, and about 3/4 of them offer just inpatient treatment for substance abuse. And when you look at kind of some specific services that are provided, nearly all of them offer screening for substance abuse. Same thing with comprehensive substance abuse assessment and diagnosis. They almost all offer drug and alcohol urine screening, and as well as counseling, both individual and group counseling and discharge planning. So these are kind of the services that almost all of them offer. You can go down the list, and there's actually a long list of various other services, but they are not sort of universal. So these are kind of the universal treatments that are offered at all of these facilities. So next I looked at, among these facilities, what type of payment do they accept? Okay, and this is important, because money kind of rules the day, and it has a big impact on whether people are going to actually use the services. All right, so not surprisingly, almost all of them will accept cash. 5% don't, and those would be the government-run facilities. So about 3/4 of them accept private health insurance. But one of the things that I thought was really striking is that the minority of these facilities don't accept public insurance. Only 38% accept Medicaid. And Medicaid covers a very large portion of the people who are suffering from opioid addiction. 26% accept Medicare, and that's also significant. There's a lot of older Americans, who have been on pain medication for a long time and are also suffering from these issues. 31% accept military insurance, 30% about some sort of state-financed health insurance. This would be aside from Medicaid. And 62% of them have a sliding fee scale, right? So if you have a low income, you'll pay less than somebody with a higher income. This is not what we want this to look like, right? They should all be accepting Medicaid. They should all be accepting private insurance. And so this is just kind of showing you a trend in spending for substance abuse services. This is not Florida specific. This is across the U.S. So one thing to notice, so it started in 2006. We were spending about $18 billion on substance abuse services, and that's gone up to $56 billion by 2015. So there's been a pretty rapid increase in the amount of money that we're spending on substance abuse treatment. And some of the things I want you to notice is that, so when you look at, so it used to be that other state and local sources, so government sources, were paying for these services, and you can see that shrinking. It went from 30% down to 17%. And so what is that being replaced with? Well, Medicaid is having an ever-increasing portion of the spending. The Affordable Care Act is one of the reasons why, because it requires substance abuse service care. But you can also see that private insurance, which is the kind of orangish red bar there on the bottom, that's increased from 19 to 29%. And things like Medicare and out-of-pocket, those have remained relatively stable over these last 10 years or so. So I just wanted to briefly mention Medicaid. So 40% of adults with opioid use disorder are covered by Medicaid. So Medicaid is really important, right? But we saw that only 38% of facilities actually accept Medicaid. But if you do have Medicaid coverage and you find a place, right, you're more likely than those with other forms of coverage to receive substance abuse treatment, right? So Medicaid does work in increasing access to treatment. And it also pays for a wide range of substance abuse treatment. It pays for inpatient and outpatient. It pays for medication-assisted treatments. And Medicaid expansion can further increase access to treatment. So, one of the reasons why we saw that increase in Medicaid spending was because of Medicaid expansion that has gone on. And so that's going to be an important piece as more and more states, hopefully Florida will follow soon by expanding Medicaid. That will help increase access to substance abuse services. Although one of the things that concerns me is that some of these states that are sort of late adopting Medicaid expansion are doing things like implementing a work requirement or adding co-pays and cost share, right? And then so you're basically decreasing access to Medicaid by doing that. And and evidence will tell you that that's not really a wise way of going about this. And of course, if you qualify for Medicaid, you're really poor, so any kind of cost sharing is going to be a major barrier to you. All right, so now I want to briefly go over some of the recent federal policies related to substance abuse that are relevant to financing. So I'm going to talk about the Mental Health Parity and Addiction Equity Act that passed in 2008. The Affordable Care Act in 2010, the Comprehensive Addiction and Recovery Act, CARA, which passed in 2016, and then finally the SUPPORT Act, the Substance Use Disorder Prevention that promotes opioid recovery and treatment for patients in the communities. And that was passed very recently in 2018. All right, so the Mental Health Parity and Addiction Equity Act. So what that did is it required insurance groups offering coverage for substance abuse disorders to make those benefits comparable to general medical coverage. That didn't used to be the case. Like you might have had to pay 50% of the cost of your substance abuse treatment services, but only 20% of the cost for general medical care, right? So this policy made it so that if you offered substance abuse, you had to make the coverage for that, the benefits, basically similar to what was going on for your general medical coverage, had to be comparable. And so that meant that, you had to have the same deductibles, you had to have the same co-pays. If there was an out-of-pocket maximum, it had to be the same. Like all of these things before the passage of this were very different, and there was much more restrictive for mental health and substance abuse care. And also things like treatment limitations. They say you only get to 4 visits for substance abuse, where you wouldn't have that kind of limit if you were getting diabetes care or something like that. But health insurance groups could still not offer substance abuse coverage, right? So if they didn't offer it, they didn't have to offer it. And so you could be in insurance, you could have insurance that didn't cover substance abuse at all. And that continued even after passage of this act. So the Affordable Care Act, which was passed in 2010 and really kind of kicked in 2014, enacted 4 primary mechanisms to help combat substance abuse. So first was the insurance covered expansions. By Medicaid expansion, that was a way that a lot more people could gain access to health insurance coverage. And then also the ban on pre-existing conditions. That was part of the Affordable Care Act. And substance abuse was a pre-existing condition that insurance companies could say, we're not covering you because you have a history of addiction and substance abuse. It also required the inclusion of substance abuse treatment as an essential benefit. So part of the Affordable Care Act, they said, if you're going to be on the insurance market, you have to offer this basic package of services, the essential benefits. And this was the first time that substance abuse services were included, and that included both screening and brief interventions. Right? It didn't require, that you do inpatient treatment or residential treatment, but at least it required some form of substance abuse treatment. It enhanced parity. So parity rules now apply to all private insurance plans, not just those that happen to offer substance abuse coverage. And it also provided opportunities and incentives to integrate substance abuse care into mainstream health care. Right? And so this was through things like medical homes. People are familiar with medical home concepts in this room? Maybe not. So in medical homes, it's like a team-based approach to providing care, and it's kind of this comprehensive whole-person care approach. And then also accountable care organizations, ACOs, it's another one where you're basically integrating all the care, and mental health and substance abuse has been a big focus of both medical homes and accountable care organizations. So next was the Comprehensive Addiction and Recovery Act, CARA. So that authorized over $180 million per year to respond to the epidemic of opioid abuse. That's good, but that's like a little tiny drop in the bucket. That's not nearly enough money, but it was something. And it had provided funds for prevention and treatment programs. It focused on funding of community-based programs. So this was more towards the prevention side of things, because that's where the prevention is going to go on in the communities, not with like individual providers. And it also included grant funding for residential opioid addiction treatments of pregnant and postpartum women. So this is obviously it's a big issue. And then finally, the Support Act. The Support Act was specifically addressed the opioid overdose epidemic. So, and what it did is it allowed for more flexibilities in states' use of grant funding. Right, so it wasn't as prescriptive as it was before. It said, what are your needs? You can figure out how your state can use this money best. It established grant programs for comprehensive recovery centers for opioid addiction, as well as establish some best practices. So some kind of guidelines for how we should be providing recovery housing. And really the focus of the Support Act was on increasing access to opioid addiction recovery services. All right, so finally, I'm good on time? You're good. All right. So I want to just mention a couple things about the demand for substance abuse services. So one is these policies that I just talked about, they helped increase access to substance abuse treatment to help meet the demand for these services. And the demand for substance abuse services has been significantly increasing. So I showed you a slide earlier that showed this big increase in spending. So just in the past 5 years, spending for substance abuse services more than doubled. We went from $23 billion in 2010 to $56 billion in 2015. I wasn't able to find more recent figures, but it's even higher than that now. So I'll show you in a second that you can see there's a really rapid increase. And a lot of this is due to the steady rise in opioid addiction, although we did see that we're finally maybe seeing it not increasing, leveling out a little bit. But that has increased the demand for treatment. And so this is looking, so this figure is basically showing you overall spending for mental health and substance abuse treatment over the last 10 years, well, 2006 through 2015. And so the blue bar on the bottom, that's showing you mental health spending, and the orange bar on the top is showing you substance abuse. And so you can see that everything has been increasing over time. And mental health has been slowly increasing, which is very good, obviously. But you can see that the substance abuse, there's almost an exponential increase in our spending for substance abuse treatment, and that has a lot to do with the increased demand, but also combined with these policies that have been passed to help increase access to mental health and substance abuse services. Right. So, what are the kind of things that affect an individual's demand for health services, for substance abuse services? So one obviously is need, right? The person, if there's an increase in the prevalence of substance abuse disorder, if somebody develops a substance abuse disorder and develops a need, right, that's going to increase obviously their demand for that type of services. Insight and awareness is also a really important factor in the demand for substance abuse services. So only 8.5% of people with a substance use disorder think that they need help and need treatment. So over 90% of people who are suffering from substance abuse don't think they need treatment. And so that is obviously going to diminish the demand. And so, this kind of points to we really need to make people more aware of, substance abuse when they have it, and how it's impacting their lives, and that they do have ways of helping. Stigma also is an important factor in the demand for substance abuse services. So people are going to be less likely to seek treatment if they think they're going to be stigmatized for getting that treatment. And that also kind of speaks to why we should be offering substance abuse treatment in primary care, and let's just call it primary care. Right? Mental health and substance abuse is primary care, so let's just call it that, and we can remove the stigma. So some other factors that affect the demand, obviously price, right? So what do you have to pay for it? And there's been some studies looking at how people respond to price. So as a little economics lesson, it's called demand elasticity. And so it's saying, basically for every kind of unit increase in the price, how does that decrease your use of services? And what we've shown is that the elasticity of demand for substance abuse and mental health services is minus 0.26, and it's minus 0.02 for primary care checkups. Right? So what that's saying is that the price of a primary care checkup isn't really going to impact the likelihood that you go and get your primary care checkup. Right? But you change the price of your substance abuse services or your mental health services, that is going to greatly diminish your demand, your likelihood of going to get treatment. Right? So price matters even more for substance abuse and mental health care than it does for primary care. And this is also like for emergency department visits. Like somebody goes to the emergency department visit, they're like, wait, how much is it going to cost? Nobody says that, right? They just go to it. But they go, wait, how much is this going to cost me when they're going to get mental health or substance abuse care? Insurance coverage obviously is important. So if you have insurance coverage, which lowers your out-of-pocket price, you'll be more likely to get it. And then access to substance abuse providers is going to actually impact your demand. So if you think or you're aware that there are waiting lists to get into substance abuse treatment, you're going to be less likely to go and seek it and to sign up for it. Right? If you finally came to the decision like, I have a problem, I need to get substance abuse care, but you think you're going to have to wait a month or 2 months or 3 months. I mean, in Tallahassee, if you need specialty mental health care, you're waiting several months before you can get in to see that. Right? So that's going to affect, you might just go out, forget it. And so finally, I just want to mention some of the factors that affect access to substance abuse services. So obviously healthcare infrastructure is really important. So the number of providers that offer substance abuse services and are accepting new patients and accepting patients with particular types of insurance, right? So that's going to affect your access to care. And it's going to vary for outpatient versus inpatient versus residential, who's accepting certain payments. The built environment is important. That's something that we don't always think about. So how long is it going to take? So let's say you're getting outpatient treatment. How long is it going to take you to get that outpatient treatment? Do I have to go drive for a half an hour or 40 minutes? Or maybe I don't have a car and I have to take public transportation. So maybe I have to take a public bus and transfer 3 times. It's going to take me an hour and a half to get there, right? Then that's 3 hours out of your day just to get your treatment. So that's obviously going to, decrease the likelihood that you're going to get treatment. And then another important thing is just the social environment. So there's all local cultures, and local cultures are going to impact your access to care, whether your community is going to be offering that type of care. And things like social class make a difference, in terms of whether you think substance abuse services is something that we should be getting, the type of job that you have, and your social support. These are all types of things that are going to impact access to care. So like local matters, so your local built environment, your local culture, those are all things that are important determinants of your access to substance abuse care. All right, and I believe that, yes, that is it. So thank you.
And I think we have